How you
I'm
doing?
good. I'm good. How are you? Good morning.
Okay, I'm good. Okay, it's afternoon for me, but thanks. Yeah, I'm doing well. So yeah, I just want to invite you on this call today because I know that you are you're in the field of healthcare.
Mhm.
Since I've known you, you've been in it and you've been pretty studious about it. So I figured in these times of trying to figure out what the health is going on out there, it'd be good to figure and tap into someone like yourself to run some questions by you to see what people can be doing in these times. So yeah, just to start off with, if you can just give a little background about who you are, your name, what field you work in, and just a little background, if you may.
Good morning, everyone. My name is Chika Nwachukwu. I am a nurse practitioner, board certified in Chicago, Illinois. So a little background on me is that I used to be a RN. I went back to school in 2017 to pursue a doctorate. So since then, I've been working as a nurse practitioner. And just to clarify what an RN is versus an APN, a nurse practitioner like myself is able to assess, diagnose, and treat patients, also prescribe meds. Our scope of practice is far more advanced than the regular RN. So I just wanted to kind of make that clear because I know in different parts of the world, a nurse practitioner is not really common, but we utilize our role here quite greatly in the US.
Okay, cool.
So that's a bit about me. Currently, I'm working at University of Illinois. So that's all
Okay,
I'll say.
so you're in Chicago. You're still in Chicago?
I am still in Chicago, yes.
Yeah. Okay. For the viewers, that's where me and Chika met in Chicago. We're both not from there. Don't worry about where we're from. Just know that
Yeah.
we spent a good enough amount of time living together or living around each other in Chicago. So
Right.
yeah, the topic today in this NeuBite Health Talk is about the coronavirus. And obviously, before we start, and I'll mention it again when we get done with the talk, this is a NeuBite Health Talk, and Chika is probably our first participant. But as well as Chika being our participant on this show or this, I guess, discussion, she has her own blog that she runs, and she uses it to talk about her travels as a Black woman and more than a Black woman, as a phenomenal Black woman, and her work ethic and stuff that she does in her life to keep herself busy. Pretty inspirational stuff. I did have a chance to look at it briefly this morning. So yeah, but we'll obviously recap that in the end when we're shouting out our different social media handles. But to jump right into this, um, this coronavirus stuff that's been going on. I'm currently in Nigeria. You're obviously in the U.S., United States, and at first, the Nigerians and a lot of people in the continent of Africa, we didn't necessarily know if the coronavirus was our portion. In the past couple of weeks and days, we have found out that there is a large amount of coronavirus to go around for everyone. So with the incidence of cases reaching our soils over here, I just figured let me reach out to somebody who's actually in it in the trenches, so to speak, not only working in the hospital but also being somewhere like United States, which has I think over 10,000 cases and maybe close to 200 deaths. So it'd be nice to know like what's happening out there and what are some things that we can be doing. So yeah, just to jump right into discussion, I have a couple questions for you. Do you think you can help me answer them, Chika?
I would try my hardest to answer, of course.
Okay, okay. All right. I just got noticed that my internet connection said it's unstable. So if it does cut out, we'll cut right back in, but no worries. All right, so just to
Okay.
jump right into it, with the first question, Miss Chika, what is the coronavirus? What is it?
What is it? Yeah, that's a
Yeah.
good question. So the coronaviruses are a large family of viruses, which generally cause illnesses in humans and animals. So this is a new type of virus. The COVID-19 is what it's called,
Mhm.
but we'll just say coronavirus just to keep it very simple and basic. So this is new, and it's known to cause respiratory illnesses among people. So it first originated in China. So
Okay.
since China, it's been spreading globally, and it's now a pandemic.
Okay. And wow. Well, thanks for that. So it started in China, but now it's
Yes,
obviously
it
made its
did.
way around the world. Uh,
Yes.
so, man, that's pretty frightening, because most of the times I believe in the beginning stages of this pandemic. I think that's what they're calling it now, or epidemic. I'm
Yes,
not sure.
it's a pandemic.
Okay. In the
And
in
it's
the in the
throughout the world. Yeah.
in the opening stages of this, I think that it was mostly thought about as almost like a Chinese virus, and I guess from my opinion, that might have been the reason why it wasn't getting so much. People weren't
Hmm.
necessarily in fear of it, maybe because we were holding it to a certain demographic of people,
Right.
and now it's no longer a Chinese virus. It's
Yes.
not a Chinese thing. So.
Yeah. And there was some, you know, language that was being used from like leadership in all parts of the world that definitely influenced the lack of urgency with this. So I agree. So
I believe so.
we won't mention any names, but it definitely did happen. So it is not the Chinese flu. It is not. It is something that originated there and is spread globally. Yes. So.
Okay. Well, I'm happy that now it doesn't have that Chinese name on it, and it's known about as a worldwide thing.
Yeah.
All right, just getting that. Okay, question number 2. Let me know when they start becoming overbearing for you. Should I be worried about getting COVID-19?
Considering the fact that it's spread to 158 countries as of now, so as of like 2 days ago, actually,
Wow.
it's a public health emergency. So yes, you should be concerned about possibly becoming infected with the virus. So, this coronavirus can be passed from person to person via droplet. That's confirmed. So if a person like coughs or sneezes on you and you kind of like inhale those droplets, or maybe someone coughs in their hand and you shake their hand, you like do a good dab or something, and maybe you forget and you're like out and about, you touch your eyes, you touch your nose, you touch your mouth, you put yourself at risk for infection. And in some instances too, like if someone coughs all over a table, or maybe they rub their nose, they had tissues on the desk or whichever, wherever you are, and if you touch the surface, and then without washing your hands after, and then maybe touch your nose, your mouth, your eyes, you kind of put yourself at risk for infection. So there are some reports that it is kind of airborne. It's not confirmed,
But
it's not
that's
really confirmed.
how not to negate this virus, but that's pretty much how most you know illnesses are passed. I'm sorry, I don't know if
Hmm.
most, I don't know if illness is the word, but a lot of kind of infections and are passed through that kind of way, right? Maybe like touching a surface that somebody
Yeah.
else who was infected touched.
To a certain degree, I would say certain viruses and certain viruses, yes, and certain illnesses to a certain degree, yes. I think with this one, the way that it's been rapidly spreading is just the biggest concern. The numbers are just kind of crazy, and the deaths that are now occurring as a result. That's where the big concern is. And this is, like I said, it's a new type, so this is what's putting a lot of people on edge. Naturally so, right?
Right. I mean, naturally, so anybody would be
Yeah.
fearful.
So yes, you're correct. So like the flu and other colds, yeah, you could definitely be at risk for illnesses, different viruses, bacterial infections, whichever.
Okay, cool. Um, it's interesting because as you're telling me this, and we're gonna be sharing it with other people, I'm also getting a chance to learn about it myself. So.
Oh yeah, what are you thinking?
Okay, so what about this? I've been hearing a lot about quarantines and then incubation, and I myself understand these terminologies, but maybe for some of our viewers and listeners, they might not really understand what that's about. So, what's the deal with this quarantine and incubation period? What's that all about?
Yeah, that's a good question. So a lot of people are being quarantined now. So I'll just start with the definitions first of all. So basically, quarantine is what's happening with quarantine. What you're seeing when you hear that is basically people who've been in contact with someone who has coronavirus, um, and they're not currently sick. Keyword, they're not sick, but they've been exposed, they've had some kind of interaction. They're being pretty much set aside for about 14 days to see if any symptoms arise. So it's just a matter of limiting exposure to other people. So the reason that they're doing that is with the coronavirus, what they're noticing is that within 14 days, people are having symptoms, so we can't really confirm or deny if you have it unless within the 14 days you start to have symptoms consistent with the virus. So that's why people are being put on quarantine, just to make sure that you're good, you don't possibly infect anyone, and we're just keeping you and everyone else safe. So it's a way to limit exposure and keep the numbers at bay.
That's
quarantine. Does that make sense?
Yeah, that makes sense for quarantine. And is incubation the same, or is that something else?
So no, incubation is the definition of incubation is essentially like the period between exposure of an infection, I guess you would say, to the appearance of the first symptoms. So that's the incubation period. So the incubation period for the coronavirus, notably, is about 14 days.
Okay.
So that's why you're seeing people, typically being put away for 14 days until, we confirm that they don't have any symptoms of the virus.
That's what was happening a lot when a lot of people were coming off of cruises. I remember watching videos of people would land in the United States, they would get their planes diverted and have to go somewhere for about 14 days.
Yeah, and even when some of my colleagues, a few of them traveled, and they had to not come back to work for they would get screened by employee health. 14 days had to pass before they could even come back.
Anywhere they were in the world?
Depending, this is back in February, but depending on where they traveled, yes. Okay. But before that, now it's kind of everywhere, but before then they were like high alert places, like obviously China, Italy, even Taiwan, Japan. All those places were areas of high risk. So if you did travel in any of those places, you would have to be screened.
Okay.
Yeah.
So another question is, how is it diagnosed? How is COVID-19 diagnosed?
So it's diagnosed with the laboratory test. So it's, imagine a Q-tip, right, that you clean your ears with, just a very long one, right, super long, and it just pretty much goes all the way in the back of your nose gently, and then they're gonna like twist it, swab it for a few seconds, and then pull it out, put it in a sample tube, and then send it out for testing. That's all it is. It's quick and it's easy.
Okay, that's simple.
Yeah.
And how about the symptoms? How about the symptoms of it?
So, okay, that's a good question. So the most common symptoms that are reported like in literature and what, the CDC, WHO, and like even different organizations are reporting is coughing. And then coughing is mostly dry. And then another thing, in about 99% of the cases, a large amount, my numbers could be wrong as of now, but for
oh no. Oh, come on. This thing is just a nonsense girl.
Symptoms, right? So those are most common. And then you still can have symptoms like that are not as common, but they can have sore throat, body aches, muscle aches, nasal congestion, runny nose, and then some people are having problems breathing as well. In the more severe cases, that's notable. And people with probably underlying lung conditions too. And some diarrhea has been reported as well, but those are not as common.
That's interesting.
Yeah.
Not to put too much about myself out there, but sometimes I might go through like a runny nose or a cough. But I can attribute that to like maybe I'm lactose intolerant. So if I eat like a cheese pizza, then I notice my nose will run, and obviously different things will start to happen with myself.
I didn't know that.
Yeah. Well, I mean, I didn't want to believe I was lactose intolerant, but if every time I'm eating a piece of cheese pizza, I'm starting to gas afterwards, I think my body, my body.
It's not uncommon. It's not uncommon among us, as you get older, it kind of happens. Yeah.
Yeah. When I was younger, I used to chow them pizzas down, but now that I'm getting older, it's like,
there's vegan options, but the runny nose though, the runny nose after eating dairy.
I get a runny nose when I drink or if I drink alcohol.
Okay.
Yeah.
Huh.
Yeah. But, I think a lot of people actually get a lot of kind of symptoms when they drink alcohol. They're just maybe like, it's whatever. Just like, smokers, if you're not a smoker, then somebody offers you to smoke. I don't care what it is. It can be marijuana, it can be tobacco, it can be meth. You're gonna cough.
You said meth?
You're gonna cough. As in you're gonna cough because your body's not used to inhaling like smoke directly like that. So a lot of people they just people push past it. Like, oh, it's just nothing. I think that's the same thing with like alcohol. Like you might feel something, but you're just like, then keep drinking. But that just might be my opinion. Back on the COVID-19. This is a health talk, so I mean, obviously we're going to go different places. But
I know, but no, that's good. I mean, I think that you should be kind of like piggyback off what you're saying. I think it is true. People should just be mindful of how their body responds. So I think that's very attentive that you've noticed that. If people are sharing drinks and they have a runny nose the next day, who knows what they got from someone? Right. I don't know. So
yeah, it's true. It's true. So back on the COVID-19, how exactly is it treated?
So it's kind of like tricky because it's a virus. And as you know, most viruses don't have, if it was a bacterial infection, we got antibiotics, right? And for some of these cases for COVID, for coronavirus, some people are developing pneumonia. So, there's also additional treatment, but that's another story. But for the most part, there are no treatment. There's no cure. But there are drug companies that are actually trying to create a vaccination for this. And I'm sure people have seen that on the news. But if people do become sick, treatment is more so done with like supporting. So supportive measures are just done to alleviate symptoms. So maybe they're having a fever and, no other complications. You want to give them Tylenol or ibuprofen, bring that fever down. Another thing is like resting fluids, things of that nature. That's really all there is for treatment. Now, for some severe cases, there are additional treatment options. I think they've been doing some research drugs and other therapeutics to help people who are really doing poorly, those who are in ICU and who may have underlying issues. But there's rest, fluids, Tylenol, maybe some coughing medication if it's really, you want to kind of stay away from anything that'll suppress that cough.
Okay, sorry, can you repeat that part after the fluids part? Your connection or my connection kind of went out.
Connection went out? Okay, so I think, so basically, after the cough?
After the fluids.
Okay, so after the fluids, you wanna, fluids, rest, Tylenol, ibuprofen, but those are things you want to utilize during this time if you are having symptoms. But things like cough medication or anything that may suppress a cough, you kind of want to stay away from that because you kind of want to, if you are coughing anything out, you want to have it come out. You don't want to suppress it. I know that in some cases, especially with some children, Benadryl is being recommended to kind of dry out the secretions. But if you can tolerate it, if you're not having problems breathing, I would definitely say chill out on the cough medication or any cough suppressants.
One thing that's been happening over here is people have been I think people are listening to the American media maybe, and they're trying to use the American media to prescribe for themselves. So I think the president, the United States president, Mr. Trump, stated something about chloroquine being able to be used to help treat COVID-19. And sadly, it looks like over here in Nigeria, some of our hospitals are getting overwhelmed because people have been overdiagnosing themselves.
Yeah.
I don't know the correct terminology for it, but they've been taking too much of it and they're getting sick now.
Wow. Yeah, I mean, it's all very new. Like, as you know, this is like rapidly changing. So this new drug, we just don't know. So I think that people should definitely practice precaution, consult with a qualified healthcare professional before you start medicating yourself, because you don't want to become sick or have any, adverse reactions if you are taking this drug and you don't really even need it. Mm-hmm. So most of the population will be okay with just using, things like Tylenol to bring down a fever, resting, drinking fluids like water, Gatorade if you have it. But we shouldn't be medicating ourselves if we aren't seeing someone to help, right? Like, manage that medication and manage this and kind of like see your symptoms getting better or getting worse. So people should really just kind of be mindful of that.
Right.
Seek medical attention before you start medicating yourself with anything that's not officially prescribed for this.
Okay. Would you say the same thing for maybe people who are changing aspects of their diet and maybe, obviously this is affecting everyone in the world, and not everyone actually, can I say, subscribes to the medical world. There's other people who might practice other kinds of ways of healing themselves. So I don't think whatever realm or whatever like of medicine you like to practice, whether it's what they call traditional Eastern medicine or Ayurvedic medicine or ITAL medicine or your Western medicine, I think it's right for anyone to go talk to like the professionals in that field to figure out how to go ahead and fight this and not try to maybe. No, now is not the time to be Mr. or Mrs. I know it all. It's the time just to lean on others and ask questions because the answers are there.
Yeah.
So moving right along. So a little bit of a morbid question. How many deaths? How many deaths have we? How many people are gone? How many traffic spots out there?
The last time I've checked in 2000, and on March 19th, that was like Friday, there were about 10,000 deaths that have been attributed to the coronavirus, COVID-19. And then that's globally. But on the contrary, there have been about 86,000 people that have recovered from the virus. So that's, a little bit, that's good to know, right?
Yeah.
So, but I will say that on last Thursday or Friday, the death toll in Italy surpassed China.
Yeah.
So that's when people started to, I believe, panic because it was kind of something I think a lot of people didn't anticipate.
Right. I think one thing though, China, I've heard it. I'm not sure if it's true. Obviously, China would never confirm it. That they're releasing the Western media from actually reporting inside of China.
Yeah.
Recently.
Yeah. So I think I read it's been kind of tricky to kind of follow China, right? So I heard, I heard initially that people who were kind of reporting these outbreaks, they were no longer found. Those who are kind of whistleblowers about the whole situation, you can't really find them. They're missing people in China. So I'm not surprised to hear that people who are foreigners are allowed to report on the issue. So it does make you kind of concerned and you're like, what's really going on there? But I did hear that too. People were being released with symptoms. Then a hotel, I believe, collapsed with people in it that were infected. That was also something that happened in China. But it's like, I'm not sure exactly. I didn't follow it that closely, but those were things that I did hear.
Hotel just collapsed.
Yeah. I don't know.
Suppression, like I guess here we go again. Do not try to suppress the coronavirus. It will come out. No medicine and no planned demolition.
I don't know. It's sad,
That's
so sad.
Okay. How about myself? Like, let's say if I'm experiencing some symptoms, should I go to the hospital or should I just try to fight it out? When should I go?
I think the best answer to that question is it really just depends. So I believe if you're experiencing symptoms like fevers consistently, like you are feeling hot, you checked your temperature, you're above at least 100.4 degrees Fahrenheit, and you have problems breathing and you're having coughs that are all new and abrupt, like the onset was kind of abrupt and it's just kind of started and you're feeling bad, I think you should definitely go and seek medical attention. Go see someone, go to ER, urgent care if you can. You can. That's something that you should definitely do if you are having problems breathing, coughing, and new fevers that are just not resolving. Now, if you are having like more of the milder symptoms that we discussed, like maybe you're having body aches, maybe you're having a bit of nasal congestion, runny nose that are all new, and you've maybe been around like big groups recently, and or perhaps you've traveled or you've been on a bus or been on a plane, or maybe you've just been in a grocery store. I would say, you know, because the hospital systems are kind of being overwhelmed to a certain degree, just see if your clinic or your healthcare provider offers telehealth services. And so those are like virtual services. So maybe you can, like kind of like what we're doing now, talk with someone face to face and have them evaluate you and see if there are symptoms there consistent with coronavirus. Or, there's other third parties. Like I think on my blog, I mentioned a few of them, like Teladoc, Amwell. Those are ones that are based in the US, but there is international companies called Mobi Health, and that's a telehealth company that they're available in North America, the UK, Nigeria, Asia. So if you do not have access to someone like a healthcare provider who can offer those services and you don't want to go in, you're kind of feeling anxious about it, consider using those services to see if you can be screened. A lot of different clinics are using telehealth services now just to limit exposure and to keep patients and themselves safe. So, but to answer your question, those are symptoms that you experience, like fevers, difficulty breathing, new coughing, muscle aches, sore throat, things of that nature, anything respiratory. If it's new.
Okay, wonderful. So I guess since I'm talking about if I need to go to the hospital, what's happening there? What's happening in the hospitals?
So depending on where you go, it just depends. I think more of the city hospitals, just know that the hospitals are kind of preparing for like the worst case scenario based on what's been happening all over the world. Primarily, Italy, they were hit so hard. Right now in the US, I believe there's about 14,000 cases, I want to say. No, 19,000 cases in the US, hundreds of deaths. In Illinois alone, I think we've had 4 or 5 deaths as of last night. So I think when it comes to what's happening, we are, at least in my hospital, what's now happening is that meetings are now virtual. People are no longer meeting in groups. Everything is online or on the phone. Another thing is that some of the outpatient clinics, some patients they're getting cancer treatment. Like the hospital just doesn't just stop. Like we have patients who are coming in for treatment, all types of things, kids who are coming in to be screened for whatever, vaccinated because they're babies. So we're kind of like, if the patient doesn't need to be seen right now during this time, they're kind of postponing it and changing the way that we communicate via phone or via virtual screening or whichever. Another thing is that we're limiting visitors in the hospital. I think currently we can't have any visitors in the hospital at all.
Wow.
Unless, it's a pediatric or a NICU patient, babies or children, right? Their parents, not both of them at the same time. Another thing is terminally ill patients who are dying, who are actively dying. They can have a guest, right? Naturally, so we don't want to limit that process. And so another thing too in the hospital is just we're kind of like on high alert when it comes to the way we're utilizing supplies. So swab kits, testing kits aren't just readily available. We have to manage them. So we're not just testing everybody. We're testing people who are having symptoms. Gloves, gowns, masks, the N95 masks are also being monitored to make sure that we have enough to utilize. And I think what's happening also now is that they're mobilizing different groups of people to screen people quickly so that we can keep people like in one place to be screened, assessed, tested, all that stuff. So they're setting up tents, drive-by clinics. It's being kind of taken very seriously. So it's good to see.
Are people in your hospital, do you have any coronavirus patients in your, or COVID-19 patients?
Yes, there are patients who are being tested.
Are you
and
with
some
them,
have-
or that's not you're not in that area?
So in the hospital, depending on where you work, yes, you know, it could be in the neighboring floor. So where I work, everybody, you know, we're experiencing patients who are coming in with symptoms. And there is a protocol that we're following to limit exposure. So patients are no longer allowed to just come up in certain instances like they were. There's now a place where you're assessed. Have you been having fevers? Have you been having any of these symptoms consistent with coronavirus? And then based on a yes or no, there are different plans put in place for that.
Okay.
So it's changing every day. But for the most part, there is a plan to make sure that patients who have been reported to have symptoms that are consistent are isolated and taken care of accordingly.
Yeah, it does seem that even although the coronavirus is something new and novel, it does seem like the hospital systems around the world are pretty equipped to, I wouldn't say equipped, but they have an idea, and maybe they practice. It's like a fire drill. You guys have already kind of practiced what a pandemic would look like. I mean, obviously now it's on the real world, but it seems like hospitals and a lot of healthcare facilities that you guys are doing pretty good work. It's not like you guys are just running around like you don't know what to do. It's like, oh, here's the procedure, you know.
Right.
The hospital, like normally the hospital might run in one way, but then you guys already know in the back of your mind any day when it comes from like I don't know what you maybe call a code red emergency. It's
right.
Everybody knows, okay, now we're changing to this other facet of serving the people. So it's pretty
right.
cool.
So we are in disaster mode for sure. And that's generally that's why we're working the way we're working. And so it's good to see support from governors and just the authority here in Illinois, because they're really making our jobs a lot easier.
Yeah.
But yeah, and so people are human. You know, there is a bit of anxiety that some healthcare professionals are experiencing naturally so. And there have been some who were exposed, and so they're being sent home. So staffing is now something that we're looking at. So that's why they're pulling people from different departments to kind of alleviate certain shortages. So.
And also, I was gonna say it's also good that you guys actually get to keep working, even though it isn't a heisty or hasty situation.
Yeah.
A lot of people around the world are being told to stay home, and economically, it's going to be. I know governments in the U.S. I'm not sure how Nigeria is going to handle it. Have been kind of promising to subsidize people for the time that they're away. These are promises, so we have to wait until after. I heard that there was going to be $1,000 check sent out to people. I don't know what that is. $1,000.
So in the U.S. there is promises to help accommodate people during this time. I know that they've suspended payments, interest rates on certain loans. I know that licensure renewal is about due around spring. That's been suspended. Businesses are being funded, so it's tickets aren't being given right now. So I mean, I think it's by state, but at the federal level, I'm still waiting on the check.
and I kind of, there were two instances when I took the COVID-19 serious. Instance number one, when they canceled the NBA, I was just like, this is serious.
I know. Yeah. I think that's when most people started to think, oh, this is a big deal.
Yeah, because
that's when most people hit. I'm like, thank you, finally, But it was not taken serious. People were still out doing their, living their life. I get it. But yeah, it was because of people's lack of taking it serious. The government had to come in from a federal level and state level to say, listen, this is what we're going to do, and you have to comply. Now I think the state is on lockdown right now. So if you are not an essential employee, you do not need to be out.
Yeah.
But we'll get into that later.
Yeah. And number two was Idris Elba getting it, but that's enough.
Yeah.
that was
Guy, man.
you know how it is.
I was like, are y'all serious?
Come
So
on
yeah,
now. You know how
people
it is.
connect celebrities to like, oh my gosh, if they can get it, then we can. And they're the most exposed, honestly.
You know, I
They're
don't think it
traveling,
was.
they're doing all this, yeah.
I think definitely it was. Yeah, he was a celebrity, but it was
Yeah,
more. It was more like for a while. You know, a lot of people of color
yeah.
thinking that it wasn't for us. It wasn't our portion.
Yeah.
So then when
Like,
we
no,
saw
no,
Idris
no,
get it,
I know.
I was like, oh man, it's damn Idris. But then I saw
Yeah.
who he was hanging around with, and I was like, Idris, come on, brother, you gotta do better. But anyway, staying on track. How do I protect myself from the coronavirus?
So the biggest thing is to keep up to date, right? So is the CDC and WHO, the World Health Organization, are definitely doing a great job with keeping the public at, up to date with the most important information. And then the thing is, best thing you can do at this point, I'll go over a few things, but washing your hands. I think people are really understanding the importance of cleanliness at this point.
Hmm.
So um, if you're going to wash your hands, wash it for at least 20 seconds with soap and water. Um, you that's the biggest way you can protect yourself and others. If you are out and about and you don't have access to a sink or soap and water, uh, hand sanitizer that's alcohol based is also something you want to consider doing, but that's in the event that you don't have soap and water. It's not to be a substitute for washing hands all the time. It's just if you don't have a sink, soap and water, right? Another thing you can do is cover your cough and sneezes with a tissue and then throw it away. Don't just leave it sitting around for someone to grab or touch. Throw it in the trash. What you can do if you're out in public, obviously, like cough in your hand or sneeze in your hand or whatever, your elbow, the inside of your elbow, excuse me. That's also something you want to do. And then just avoid touching your eyes, your nose, your mouth with unwashed hands. Just be cognizant of that. Now, if you're at home and you haven't really done much, obviously the same rules don't apply. But if you're out and about, or maybe you have kids or you have a partner, just be mindful of your your hands, cleanliness wise. And then a biggest thing is staying home. Um, People are just having trouble staying home. So that's how we can kind of flatten the curve. And I think people have been hearing, what does flatten the curve mean? And it's really just, our hospital systems don't have the resources to accommodate people if so many people get critically ill, right? So we're just trying to get to a point we don't have to, go in that direction. And we want people to be able to help us out by just staying home and just making sure that they isolate themselves. And it's tough, I get it, but this is really what's going to help. Social distancing. The CDC said if you have more than 10 people in one room or gathering in one place, you can't do that. You have to have a virtual conference or cancel it. So it's just something we need to take seriously. If you don't need to leave the house, don't leave. Just stay home.
I mean, that's how it should always have been, but
yeah, but I get it. People are on spring break and kids want to go to the beach, but this is really serious. We need to stay home and
I think
comply.
people can still go to the beach. They just have to go by themselves.
But then if everyone's going by themselves to the beach, what does that look like?
Yeah.
Yeah, so it's tough. I mean, I'm not gonna deny that staying home and being around maybe your kids are not in school and or maybe you don't have anybody around you to like socialize with, but that's FaceTime. There's movies, there's books. This is a good time to focus on something that you've been wanting to work on if you can, right?
Yeah.
Another thing is just limiting contact with at-risk groups. So they're middle and older adults who are definitely more at risk for complications. If you don't have to be around them, especially those who are immunocompromised or who have underlying health conditions, maybe you have a parent down like that you don't live with but you like to visit. If you've been around people and groups of people, maybe just limit like going there, maybe wait a couple of days and see how you're feeling and then visit. But just be cognizant of certain groups and just be kind of chill out. Don't bother them too much. And also cleaning and disinfecting things, so surfaces and with Lysol and Clorox wipes, also important. So those are ways that you can protect yourself. I kind of went on a tangent there. Did you get all that?
I got it. And I think it's great. It's good. I didn't hear toilet paper in there. So,
Oh, yeah. Yes. And another thing, just be kind, guys. Like, don't buy everything up. Like, think of your fellow human man, like your fellow human. Like, just be considerate. You don't gotta buy everything up. Honestly, there's enough for everyone.
yeah. And I think, well, I know that the human body can survive without food for a pretty long time. I mean, like, I think it was the beginning of the month or end of February, leading into March, I was on a 1 week only drinking water. I didn't die.
Oh, how'd that go? It went
It's
okay?
beautiful. What?
Oh,
It's amazing.
I
It's a great feeling.
gotta
Obviously,
try it.
my
Maybe.
energy levels were low, but it gave me it. All the energy was in my mind, and it did some good work to me. I loved it.
Did you tolerate food okay after?
Come again?
Did you tolerate food like how
It was fine. I tolerated
oh,
food pretty fine. I
nice?
already don't eat a lot of junk food, besides a slice of pizza here and there. I usually only drink water. So
Okay.
it was okay. I didn't go out
Okay.
and have a whole bunch of donuts. I actually did it because being in tune with my body, I was before I came to Nigeria, I was in Detroit, and I had developed because Detroit has a plethora of donut shops. I'm not sure why, but there are many donut shops, and
So you had a lot.
I had some donuts. Every time I would go in for one, I'd end up with four. And after eating that many donuts, I would come home and feel like I usually do push-ups at night, and it became difficult to do my push-ups at night.
Yeah.
So I was like, "What's that about? That's interesting." I looked it up and saw that sugar can cause inflammation of the joints, and I realized, you know what? I'm way too young. I'm only 29 years old. I'm way too young to be having my joints inflamed because that can lead to other issues. Um,
Yeah.
so,
And sugar itself, I'm a firm believer that moderation is key. So when it comes to sugar, high carb foods, fatty foods, it's not something you eat every day. It's just a little bit here, a little bit there. Sugar causes a lot of issues when it comes to, health. So I
yeah.
think that's good that you were proactive in that. Now with the water, the whole week of just water, definitely. I'm not condoning that. I'm just saying, just consult with the healthcare professional before you do that.
Okay.
For the
Everyone
people
else, yeah, for
out
sure.
there, for the people out there, yeah, for
Yeah,
sure.
for the people out there, for sure.
Yeah,
Consult with. Uh,
yeah,
don't try to do the same things you were doing when you just.
yeah. And
Yeah,
I'm not, yeah. And that's interesting to see that you've read about sugar and affecting the joints. I'd have to look more into that, but you
yeah.
know, but yeah, for sure. Moderation, people, is key.
And finally, on the coronavirus topic,
Yes, back to the subject.
how can I stay updated? Usually, my sources are, and it's quite interesting. A lot of my material comes from YouTube
Yeah.
through watching like maybe MSNBC or Fox or something like that, and social media, Instagram. That's my form of social media, Instagram. And I've noticed that a lot of the news I'll get from social media, and then I'll go look other places. So,
Yeah.
like,
I
where?
think,
How
I
can I
mean,
stay updated on this? What are your
yeah.
opinions?
So in the age that we live in, like we are definitely looking at Twitter, looking at Instagram for updates. But considering the fact that there are so many like misinformation out there, myths really, I would just be cognizant, just be mindful of what you're taking in. So first and foremost, the CDC and the CDC is doing a really good job with literally shooting out updates hourly. So that's something that you want to keep priority. Like that's first on the list. CDC, what's the new updates, right? Because they're changing all the time. Secondly, obviously, like the news outlets, maybe not Fox, but certain outlets that are okay, and just kind of gauge what your local and state authorities are saying, right? Because everyone lives in different places, and we don't know what's happening. Like what's happening in Chicago is different from what's happening in Lagos or whatever. So just a sidebar. Um, don't rely on social media. But if you do, CDC has an Instagram. You can follow them and get more up-to-date stuff. And there are other, valid health organizations like John Hopkins, the Cleveland Clinic, different places like that, which are reputable. Um, you can just use them.
Okay.
I don't know if that interrupted your call, but yeah, just don't rely on social media, guys. make sure that you're being smart about the information you're intaking. And I know a lot of people are getting anxious too because they're looking at all these things people are posting, and I'm having people calling me like, "Oh my God, I'm seeing this on Instagram. Is this true?" And so it's just excessive. So just be mindful. Put your phone down if you need to. But the
Yeah.
CDC is my number one choice.
Yeah.
Okay.
I appreciate that. And I guess one thing that's it for the formal questions, but more for like a little just discussion, just to wrap things up. What about someone like myself? I like my exercise. You know, this morning I did some weights, and then I went for
Yeah.
a run. It was in the
It's good.
sun. You know,
Yeah.
I'm out here in this African sun, and it was feeling good. Took my
Must
dog.
be nice.
Are these good? Am I supposed to be out there, you know, staying fit, trying to?
Yeah. So I think that for sure, like within your within what you're able to tolerate, right? Um, Hiking, outdoor running, that's not been banned here in Illinois. Obviously, if there's like large groups, you want to just kind of keep your 6 foot distance, right? When running or something. But for the most part, activity outside is okay, depending on what you can handle. Indoor activities, there are so many YouTube videos with different workouts. But if you're an outdoor person like myself as well, definitely go out there, take a walk, get out of the house, just practice precaution, right? Come inside when you're done, wash your hands first, and then you go about your business. So yeah, for sure.
Wonderful, wonderful.
Yeah. Um, so yeah, so any other questions
No,
about
that's
anything?
it. I think that our viewers here will enjoy the past questions that this question and answer period that me and you just went through. And so, yeah, that concludes our discussion here. So if you, Chika, would just like to let the people know where they can find you with your blog and who you are one more time.
Yes. So I have a blog that I launched recently, and it's called Chika on the Go. So ChikaOnThego.com. And I'm sure he'll post that. But it basically it talks about health. It's like a health hack. So we discuss things like the most up-to-date tips on not just traveling, but ways that you can just stay healthy and live good, right? So in light of the coronavirus, I've been posting a lot of things to help alleviate anxiety and educate people because I do have a bit of health experience, well, quite a lot actually. So I just want to make sure that people aren't being misinformed. And a lot of my information comes from the CDC and WHO and other reputable, am I saying that word right? Oh my God, reputable organizations. So not only that, but I also talk about my travels and I try to make it fun. And then you can also follow me on my social media handle. My Instagram is Chika on the Go, at Chika on the Go, just like the website. So if you want more photos of me and more information on health stuff, follow me.
Yeah, so everyone should follow Chika on the Go. Check out those photos of her.
Chika on the Go. Get it? Chika on the Go.
Chika is definitely on the go, even though she does work.
Always.
She does work a standard professional job. She still finds her way to get out there and see the world. So yeah.
Yeah, as we all should. Not yet, not now, but when this all
in
clears.
time.
Yeah.
Yeah. Well, all right, Chika. I know that you have to get ready for work over there. It's a little bit late in the night for me, but I know it's early in the morning for you. So just thank you for the conversation.
Of course. Thanks for having me.
Hopefully we'll be out of this soon. And the conversations will be about other stuff, like how to be healthy. Maybe the next conversation we have are like fitness tips or
for sure.
healthy when traveling.
Yes,
hopefully the next conversation will be about travel because
yes.
We don't want to be held down. Of course, it's good to be still, but we want to get ready to move around again.
Yes, God willing. Amen. Yes.
So thank you, Chika, and enjoy the
rest.
Of
You too.
Okay.
Bye.
Bye-bye.